can count on. This is Martha. I implore you to Jerry Wanyo from the last hour. A lot of things to say, but time did not permit us to take more calls on that show. But now we are in the girlfriend show. And of course, my girls are in the studio with me. I have Olububus one, no other one in the studio. And of course, I have, Lola in the studio. But we're not alone today. What do we know about what we want to discuss? Quack! Let's not take you to the wrong road. We have a professional here in the studio with us today. We have Dr. Harriet Amegon. Did I say that right?
Yes.
Welcome on the show.
Thank you.
Thank you so much. Well, actually, so it's the girlfriend show, and it's a bit of a rapport kind of thing over here. But yes, thank you so much for being here in the studio with us, guys. Did I mention that she's so pretty? You know, the girlfriend show, we appreciate pretty ladies, and this one is pretty, and she has quite an amazing dress on, which she might give me after the show.
No, not you. Me.
You're lost inside. Yes, back to business. Yes, guys, it's the girlfriend show, like I said earlier. And before we started the show in the morning, we talked about how we will be discussing cervical cancer today. You know, this particular thing, people have a lot of misconceptions saying this is the cause of cervical cancer. This is too many things. And so we say, you know what other time is perfect for us to enlighten our ladies about this? Not just the ladies. We're enlightening the men as well, so that you can look after the ladies that are close to you. This is your wife, your mother, your girlfriends, and your daughters as well. So thank you so much, Dr. Harriet, for being with us here on the show.
I'm honored to be here.
All right. So when we talk about cervical cancer, what do we mean?
So cervical cancer is cancer of the cervix. The cervix is like the entrance to your womb. So where the baby comes out from. So during pregnancy, when you go to the hospital and the nurse checks you and he says, oh, you're 1 cm, 10 cm, that cm that you're dilating, that's your cervix.
Okay.
So that's like the entrance of your womb. So any cancer that affects that part, the cervix, that's the cervical cancer.
Cervical cancer.
Yes.
Okay. So what some people cannot say is too much of bread, too much of okra that causes cervical cancer. So what's the major cause?
The major cause of cervical cancer is a virus.
Okay.
That lives in the body?
No, it doesn't. It's actually sexually transmitted.
Oh,
So
wow.
Yes.
the virus that causes
Yes, the virus that causes cervical cancer is sexually transmitted. Exactly. So there's a lot of information out there about breast cancer. At least every person, almost every woman knows that you should check your breast. If you have a lump, you should go to the hospital. But cervical cancer, we don't really talk about it enough.
Okay.
People don't really understand that a virus causes cervical cancer. And the most mind-blowing thing about it is that there's a vaccine to prevent this virus. So basically, there's a vaccine to prevent the
Hold
cancer.
up. You are giving us
Too much information, right?
a lot of this is too much business right now.
Exactly.
Like, I'm trying to assimilate the fact that this
caused-
cancer is caused by a virus.
Yes.
And it is sexually transmitted.
I thought it actually lives in the body. That's what I thought.
No.
Wow.
Yes.
I thought it's maybe by what we eat, infection or something, then it degenerates to.
Ouch.
So this is virus. What's the name of this virus?
The name of the virus is HPV virus, human
Papillomal virus.
Yes. So this virus causes other things. It causes other forms of cancer, oral throat cancer, penile cancer. But those ones are they are not a problem. But cervical cancer is a public health issue because this HPV virus is the most common sexually transmitted infection. So 8 out of 10 women will get infected with HPV virus. Yes.
It's high.
Yes, it's very high. But not every of them will go on to cause cervical cancer. So cervical cancer is caused by persistent, untreated HPV infection.
Okay.
So because it's a virus, your body can just fight it off and it goes on its own.
Okay.
Yeah. But for some selected few, it will persist and then it may cause cervical cancer. Yeah.
Okay. So like when we talk about malaria, we talk about the ratio here in this part of the country, how it is now like a domestic disease.
Yes.
Everybody must have it. And we treated some misconceptions about that the other time.
Yeah.
Now this am I calling it cervical cancer, is it right?
I think it depends on the British or the American.
I'll
Everyone
use-
is fine.
I'll use cervical,
Everyone is fine.
Okay, so talking about this cervical cancer.
Yeah.
Now, what are the main? You've said the human papilloma virus.
Yes.
Now is the main
Yes.
How can you prevent it?
Yes.
If it is preventive.
So, this HPV infection, because it's sexually transmitted, it can be reduced by using a condom.
Okay.
But it's skin to skin contact. So
Okay.
when you wear a condom, it doesn't cover every part of your penis, right?
Okay.
So there can be some contact between your skin, between the skin of the man and the woman. Yes. And then another factor to be aware of is the fact that even with outer course, yes, outer course is a real word. It's non-penetrative sex. Yes.
Yeah. Okay,
So
guys.
with that,
There is the intercourse and there is the outer course.
Yep.
Please explain that term for us before we move forward.
outer course is non-penetrative sex. So it's when the guy says, "Oh, just the tip."
Oh my God.
Yes. And then he uses just the tip. Yes. And then he uses the tip of the, just play around out there. There's contact, so it still increases your chances of having this HPV virus.
Okay.
So that's why it's so common to transmit it.
Okay.
So when it comes to prevention now, we have you have the primary level, you have the secondary, you have what we're doing here now is the tertiary level, the third level of prevention, education, advocacy, awareness, people should know about this. But the primary level of prevention is the vaccine.
Okay, so there's a vaccine for
Yes,
this.
there's a vaccine for this. So you have to stop the virus from even getting in contact with your system in the first place. So you have a vaccine for that. And then the secondary prevention is now the test. Early detection is key.
Okay.
How often do you go for this test? You need to go for the test every 3 years.
With or without the vaccine?
With or without the vaccine, yes.
How many
Every 3 years. Initially it was every 2 years, but now it's every 3 years. So your cervix is in there, right?
Yeah.
The thing about our environment is that you can have 4 babies in the hospital here and nobody's going to check your cervix because it's inside there.
Yeah.
Yes. So, and cervical cancer is mostly asymptomatic. By the time you start having
So
symptoms,
nobody
there's a
knows
problem.
actually.
You really don't know what's going on in your cervix if you don't go for this screening. Yes. So you have all these babies. Nobody has ever told you, hey, you have to check your cervix. You have to do your pap smear. You have to, So you just continue living your life, and then later on you're like, there's pain during sex. There's bleeding after sex, or you complain that I've been treating infection. Every time I'm treating infection, it's not going. I don't know what's going on. Yes. And every time you go, they keep doing the infection test, and nobody's like, maybe I should check for HPV. Maybe I should open you up and actually view your cervix. Nobody's really saying that.
So doing that, checking that cervix,
Yes.
it has to do with surgery.
No.
Is it a
doesn't.
surgical procedure?
No, it doesn't. So when you go for the screening, they use a speculum and open you up.
Okay.
Ouch.
Yes.
Is it painful?
Yeah, that's the first question. That's the first question.
It's
people
painful.
hear.
Oh my
No, it's not.
Oh, you just said
There's
yes,
some
no.
discomfort. There is some
Definitely.
discomfort. Yes,
Okay.
definitely.
Definitely.
There's some
Discomfort?
discomfort. Slight discomfort, bearable. Yes. But
Scale
pain
of
is
1.
relative.
Okay, very
Pain
good.
is
I wanted to
relative.
say on a scale of 1 to 5.
Yeah, it
how
depends on your
bearable?
threshold, but it's very bearable.
Okay.
You just need to breathe through it. It's
Okay.
a necessary evil. And bear in mind that it's only once in 3 years.
This is how
One
they'll tell
time.
you.
Exactly.
They'll tell you. There's this NG tube. They'll tell you it's not painful.
No.
It's not painful, but it's traumatic.
Yes.
Okay.
So they open you up and then they view your cervix,
Okay.
and then they take a sample from the cervix and they test it. And when they open you up, they can see your cervix. So from that initial viewing, they can tell like, okay, this looks good, this doesn't look good. I should go for this test, I should go for that test, because there are several tests you can do for this cervical cancer and for HPV virus.
Okay.
So that's what we're looking for when you go for tests. You're looking for HPV, the presence of the virus, or the nature of your cervix. That's what
Okay.
you're looking at. So when you go for this test, they take samples from your cervix, send it to the lab one time in 3 years. If you're fine, in 3 years' time, you don't have to worry about
Then
it.
you go back
Okay.
again.
After
In
3
3
Opened up
years.
again.
In 3
3
years.
To be
Yes.
opened up again.
Well,
the memory of the first one must have gone.
exactly.
So you have 3 years to heal from that.
I mean, we
So-
go through women go through childbirth, very traumatic, and then in 6 months' time, they're pregnant again.
That's great. They're pregnant again. And you ask them, well, you know the one shouting.
Yes.
They'll tell you, they'll tell, I will never, God, if you help me.
Yeah.
And next time, they're pregnant. What happened?
Exactly.
Okay.
So
that's
that's it. So that's what the test entails.
okay.
You go for the screening, and so because like I was saying earlier, the cervix is in there. If you don't go for this screening, you would never know. to economic climb. We're in a place where healthcare is poor. We don't have the money. You don't want anything to advance more than basic because we don't even have the facilities. That's the honest truth. We don't have the money. If you're treating cancer in Nigeria, you're looking at 500,000 naira per month, at least, depending on the kind of cancer. Yes. Yes, exactly. Depending on the kind of cancer and the hospital. And you're not even sure it's optimal. The care is not even really optimal.
Of course.
Yes. So we're screaming prevention. These tests are available in most labs in town.
Okay.
There are even some NGOs that do like subsidized testing, like health platforms. They do subsidized screening for this HPV infection. When you are aware of this and you go out of your way, you can say, okay, on my birthday, if you put a benchmark, my birthday every 3 years, I would remember that, I'll do it. Yes, because we're in a place where we rely on the government for social change, for everything.
We sit back and relax for the government.
Yeah, exactly.
Government.
But gone are those days. Now you have entrepreneurs coming up that are finding solutions to our issues. You're sitting back and saying, what do we need? What's our problem? How can I solve this? Instead of waiting for the government to come. You know, other developed countries have planned and organized screening programs. Yes, you're 21, 26, they are calling you every day. You have to go for a pap smear.
What's a pap smear? I think I've been seeing that one too many times appear on my feed online.
Yes.
What's a pap smear?
So a pap smear, it's a cervical screening test. What they do during pap smear is they open you up, they take a sample of
so the process of the test is called a pap smear.
the test is called pap smear. Yes. What the pap smear does is that it checks for cell changes on your cervix. So there are two types. You can either, when you do the basic screening, it just tells you, oh, your cervix doesn't look good. There's HPV infection there. Then if you want to go for the higher test, which is the pap smear, if your pap smear comes out positive, it's already pre-cancer. Yes, because it means you've had the virus long enough for your cells to change to now give you a positive pap smear.
But at that stage, can it be treated?
Yes, it can be treated.
At that stage.
Yes, it can be treated. Everything caught early can be treated.
So I have this question for you.
Yes.
I want to know how true is this, that a woman who breastfeeds very well has a lower risk of getting cervical cancer. Is it true?
Is this cervical
Or breast?
cancer?
I heard that for both breast and
cervix and breast.
No, most gynecology cancers are controlled by your hormones, estrogen and progesterone. So the fact that if you start your period early, too early, and you go to menopause too late, it means that maybe you start your period from 9 years and then you achieve menopause at 45. It means that you've been exposed to this estrogen and progesterone up down for a longer period than anybody that will start their period at 12. So starting too early and going on menopause too late, yes, exposes you to all these gynecology cancers. Yes, so that's what they mean by that.
So all right, who is at risk for this kind of cancer? You know, some of us will say a 5-year-old, a 10-year-old might not have any business with such a cancer. It's for the people up there.
Yes.
So what age range? Is it just all women that are at risk for the cervical cancer, or
So long as you have a cervix, you're at risk.
regardless of the age?
Regardless of the age, because you're going to grow up. Even if you're young now, you're going to grow up. Bear in mind that it's sexually transmitted. So it's really from the age of when you're exposed to sex. Now, we can say 15 years. In Nigeria, for example, 15% of girls have had sex by the age of 15, as opposed to boys. Like 2% of boys have had sex by the age of 15 in Nigeria. So women grow, they advance quicker than men, right? So we can say from 14 years, they start having sex, right? 14, 15 years, they start having sex. But in our region, we have to keep in mind child marriage. Yes. So you have children that are getting sexually active earlier, there's rape. Yes. So we have children that, so even though the benchmark is from 21 years, you should start having the screening. But ideally, 3 years after you're exposed to sex, you should start having the screening.
Okay, so the person who is sexually active is at higher risk.
It's at higher risk, yes, because the more partners you have, the more exposed you are to this virus.
Okay.
Men don't have a cervix, but they carry the virus from woman to
That's
woman.
why I'm confused. That's why I'm confused.
Well, but they
Why
also
is
get
it-
it from women, so everybody is
They can have the
transmitted.
HPV
Yes,
virus.
they can have the HPV.
So what does
virus.
it do for them?
What happens to them?
Maybe 1% of them can have penile cancer. Maybe during oral sex, it can cause like throat cancer, but that's not even, it's a really
rare condition.
Very rare condition.
Okay.
So the problem is cervical cancer. Is the cervix that has the problem.
Okay.
The penis getting into the cervix and depositing this virus and going to another and going. So the more partners you have, you are at higher risk for this HPV infection.
All right. Moving forward. Now we know that, these things put us at higher risk. Sex, you have said, unprotected sex puts you at high risk for this cervical cancer. What other things put you at high risk? There are some things like they say is airborne. You have to, be cautious, wear nose mask. There are some they say, tuberculosis.
Yes.
They say when you share this and share that, it puts you at risk together. For cervical cancer, apart from sex, what other thing puts you at high risk?
Transmissible? Can it be transmissible? Okay, yeah.
Yes, it's sexually transmitted.
If it's
yes.
not,
So because 80% is caused by the sex, the remaining 20% is probably not. It's not such an issue to go into it as much, but you have a family history. That's one thing that is a problem for cancers. When you have a family history of any cancer, when you have a family history of any cancer, you're at higher risk. Yes, and then normally poor health behavior choices, alcohol, smoking, the regular things that cause other cancers.
You at higher risk.
Yes.
Yeah, so before we started, we were saying something off air that people don't really want to go and check themselves in the hospital. So what are you doing to make sure people or ladies or women,
the awareness, creating the awareness?
How are you creating that awareness for people to know that I have to go and check myself, especially ladies or women?
That's why we are here. That's why we're at the radio station. We're trying to let people know that this thing is real. It's more real than you imagine. Cervical cancer is the second cause of cancer death in Nigeria amongst women. In the world, it's number 4 amongst women, but in Africa, it's the second after breast cancer. Yes, so it's a problem. So out of in 2020 alone, about 57% of the people diagnosed with cervical cancer died. Yes, it's very scary. It's very high. So maybe hearing 57% doesn't make sense. Say out of 5 people diagnosed, 3 died. Yes, it is very scary, and it's a very preventable disease, right? Because it's very slow growing. HPV infection takes about 5 to 15 years before it becomes cervical cancer. So you have so much time to intervene. There are so many things you can do. You just need to be aware that you need to be aware that hey, I have this, and these are the options available for me to treat this. But if you don't know, you're not going to do anything about it. So imagine coming down. Yes, we have a terrible health-seeking behavior in this country. In Africa, we mostly rely on faith. It's like, oh, God will do it.
God. Why did he make doctors, please?
That's not to say God doesn't do it.
He does it.
Yes, but he uses
the doctors.
Personnel.
I said through you.
Through men to men.
See, I've said it. Oh, you sound like you're coming from where I'm coming. But yes, when they talk about health behaviors like this, people say, God will bring it. Cancer is not my portion, and all of that. But what people don't understand is the doctors, medicine is God's mercy system. In fact, it's already God's intervention. To giving you wholeness. But you're not leveraging on the opportunity that he has given to you. It's when it's a job, we will not say God did it. When it's a car, it's God did it. He gave you doctors, God also did it. Because he's giving you the opportunity to not just die anyhow. He's giving you the opportunity to, check yourself regularly, because he knows that the system that he created. And that's why he made such a thing available. But here we are.
Also, to crown it all, people have bad living styles, the way they live,
very poor
habits. So sometimes this habits also encourages what you're talking about.
So that goes to our next question. Are there habits that can cause cervical cancer?
You have like drinking, like alcohol, for example, and drugs. When you take these things, it reduces your inhibition. So you are at a social gathering, and what you would usually say no to, you find yourself saying yes to it. You are at a place and they're like, oh, let's do this, and in your head, like, I shouldn't be here, I shouldn't do this, but then you can't really say no, and then you go ahead and do, and the more partners you have, the higher risk.
Multiple
yes, exactly.
The higher risk.
So now you have that alcohol, drugs, all those.
How accessible is treatment for cervical cancer. You know that we know malaria is very accessible. And we also know that tuberculosis, there are treatments, there are places you get to that you have free treatment for tuberculosis.
Yeah.
Do we have such free treatments?
Aha.
And are there platforms that make this treatment very accessible? First of all, let's not crowd you with questions.
Yes.
How accessible is the treatment for cervical cancer?
Well, you can go to any hospital to get care.
Okay.
Right. And the value, the type of care you get depends on the hospital and the people available there. There isn't a specific hospital that I can say, oh, they would deal with cervical cancer. Usually we have tertiary institutions here, big hospitals that deal with all types of cancers. Yes. But we are faced with low manpower. We are faced with lack of facility, amenities. Thank you. So we are faced with that. So you cannot really say we don't even want to hear cervical cancer. We're screaming and shouting and going everywhere to talk. We're telling women you have to be aware, because we don't even want to hear cervical cancer. Because we don't really, the management. So when you have this HPV virus, you have options for treatment to not let it progress cervical cancer. You can do cryotherapy, where they freeze the cervix. They just put like ice and it freezes, and then as it melts, you would just have like excessive discharge, and then the cells that have changed will just pass out. Yes, you have that. You also have like LEAP, where they use heat to remove the abnormal cells. You have those options available in some hospitals. You would have to go and find out. Yes, you have some NGOs that are focusing on this. Like I said, I think there's an NGO that focuses on that. You have health platforms, they do that. You have some other labs around town. I think they should be able to do that.
Okay.
Yes.
So at what cost? Is it expensive or
Well,
is it affordable? Because
it's expensive.
okay, you see, this is where the problem is.
Yes.
Now in Nigeria, we know how to do sensitization.
Yes.
We know how to create awareness.
Yes.
But now accessibility
Yes.
to changing the situation where we are crying people should change.
Yes. That's why we're saying prevention is key. Prevention is key. So I talked earlier about primary prevention, which is the vaccine.
Okay.
This vaccine is supposed to be on the regular immunization schedule for children from 9 years.
Okay.
Yes, from 9 years, women are supposed to be immunized against HPV virus. Yeah. But then we are left to go out of our way to make this happen.
Okay.
Because we have countries that have regular screening programs, they are vaccinating schoolgirls, but we don't have those running here.
But those vaccinations,
once again,
are they approved here?
Yes, they are approved. They are approved worldwide, and they are available. You just have to know that it's available. You know where to get it. It is scarce. It's expensive. But what is preventing is better. Because one weekend, how much you spend on Ashebi? And then when you hear the price, it's like, it's too expensive. But you're trying to help your child never have to worry about cervical cancer in the future. And you're complaining about the cost. I mean, I understand where we are coming from, but it takes planning. If you plan, if it's important to you, you would plan and say, okay, I'm going to put this amount of money aside monthly and be able to achieve it. Because this vaccine, if you take it before the age of 15, you only need 2 doses of the vaccine.
Okay.
Yes, 6 months apart.
Okay.
But if you take it after 15, you would need 3 doses of the vaccine.
Okay. So it's better to get it early.
Early?
So
yes.
okay.
Sorry, another thing about this vaccine, sometimes people are scared of, especially in this part of Nigeria, when it comes to getting vaccine.
Because they're not sure.
They're not sure. So how do you tell them? That there's no side effects, nothing will happen to you? Because the myth going around, especially if you're a lady and you're married, they feel that okay, if I take the vaccine, I might not be able to give.
See the COVID vaccine.
That's that exactly.
So that's what as far as saying
that yes, it's harmless. It's something good for you.
There was during COVID, there was a lot of conspiracy theories going around about vaccines. A lot of people became aware of what was happening with vaccines, and then all of a sudden they are like, oh, I'm not going to take vaccines anymore. You have to understand where you're coming from. When Americans are saying they are not going to take vaccines, you can't stay here and say you're not going to take vaccines. We don't have the facilities they have to prevent, to treat you if you come down with these things. Yeah, and historically vaccines save lives. We've come a long way from polio, We've come a long way from measles, unnecessary deaths that vaccines save. And there's nothing like there's no side effects. People like to hear that. But everything has a side effect. You would say less. It doesn't really affect you. It doesn't change your DNA. Exactly. It doesn't stop you from getting pregnant. It doesn't make you sick. Yeah. Of course, the immediate side effect. Yeah. No, it doesn't even cause weakness. This vaccine doesn't cause weakness. Okay. Yes, you might feel the normal regular prick, the pain, the redness around the side. No, but you don't feel the dizziness. The measles vaccine, you're weak, or you're saying, oh, the children are 9, they are young, maybe fever. You don't come down with fever with this vaccine. You just take it and you know that you've been protected. Okay. Yes.
All right. Let's quit talking a lot. I hope you guys have been jotting these things down because it's very important. We don't take our health seriously in this part of the country, and we have been hammering on it time after time on the need for you to do periodic checks. My dear ladies out there, this is for you. Yes, we'll play a music. Why do I say you play music? No. I'm not from the 90s. We're gonna play a song, and when we get back from that, we will open up the phone line so that you can ask Dr. Harriet any question that you have. In the meantime, do not go anywhere. We will be right back.
Crack your wrist and banter till you tire.
I can tell you got beat energy.
The Midday Extra is a mix of fun, entertainment, and sick jokes to keep you jiggy all day.
They'll do fine makeup. They'll even wear frontal.
They wear frontal.
Join
Join Danny Sucre and Matha every weekday from 10 a.m. to 2 p.m. on Eagles 102.3 FM for the Midday Extra Show. Peace out.
All right, guys, welcome back. Yes, you still have Matha on the show, and of course, Dr. Harriet. We have Olububus and Lola here with us in the studio discussing cervical cancer. Yes, that's how it's called. That's how it's called. Yes, we've been discussing it, and we hope that you have been getting all the information that you need about this. Now, the phone lines will be open, and you can call in and ask the doctor whatever it is you have on your mind. 09073530044 or 09087668888. On WhatsApp is 09097054450. This program is streaming live on YouTube, and you can check us out at Eagles FM Abuja. Hello, good afternoon.
Hello, good afternoon.
Please, your name and where you're calling from.
Mimi from Suleja calling.
Mimi, can you turn down the volume of your radio?
My radio is not on.
Okay. Let's hear you, Mimi.
Okay, the doctor have been off. Sorry, don't be offended.
He's nurse. He's doctors.
Please, if one wants to go to hospital for this cancer checkup, like how much can the person hold that no harm, no harm? If I go to hospital with so amount, at least they can run the test for me. Just give us idea of how much can we go with. I know it depends on the type of hospital, but I just need just how much I can go with. Thank you.
Okay, so I don't really know how much it will cost. I know several hospitals will do it within the range of 15 to 20,000.
Sorry, please keep listening. That, I mean, it's a bit tedious to the ears, but
yeah. So I know most hospitals will do it between 15 to 25,000. But I know that there's an NGO, Health Platforms, that does subsidized screenings. Yes, subsidized rates. So
let's see who we have here again. Hello, good afternoon. Hello.
Yeah, good afternoon. Can you hear me?
Yes, we can. Your name, please, and where you're calling from.
My name is Wale. I'm calling from Apple.
Wale.
Yes, please.
Okay, welcome to the Girlfriend Show. Let's hear you.
Okay, on the lighter note, what you played earlier is the music, not a song, because you went into the oldies. That's what I like earlier.
Okay. What did you say? That's my favorite song, by the way.
Okay, nice to know. The doctor in the house. My own basic knowledge of, I'm not a medical practitioner, but my basic knowledge of cancer is that it's an abnormal replication of the cells of the body. There are so many types of cancer. We have leukemia, cancer of the blood, cancer of the bone, and all the organs of the body. But I want to ask, this HPV virus, is it the major cause of every cancer? That's my first question. Then second thing is, you said cancer is treatable. I want to be clear on that because I've always thought or learned that cancer is just manageable, that is not treatable. Maybe you meant HPV is treatable. I don't know. Maybe cancer is treatable. Maybe you need to expatiate on that. Then the advocacy you guys are doing, especially when you mentioned the vaccine, can't the NGOs and some other bodies push for the government to have these vaccines introduced by the primary health care centers as one of the vaccines to be taken the public, compulsory? Like, we have some compulsory vaccines for members of the public as you grow. So can't we have an advocacy in that direction to compel the government to adopt this HPV vaccine as one of the vaccines to be taken? So let me leave you to answer those questions.
All right. Okay, thank you.
Okay, Wale. So the HPV virus is just for cervical cancer. It's not for every kind of cancer. It causes a small percentage of penile cancer and oral cancer, but it's mainly cervical cancer. So 80% of cervical cancer is caused by the HPV virus. There are different strains. So you have type 16 and 18 that are the culprits of cervical cancer. Then to answer your second question, what was the second question again?
He said, is it about all cancers?
Yeah, I answered that.
Okay, you said
yes.
It's not all.
Yeah,
and he
not
now
all
says,
cancer.
you said it's treatable.
Yes. Okay, he mentioned something about are all cancers treatable, or is the HPV virus that is treatable? Prevention is key. Everything caught early is treatable. Cancer is treatable if it's caught early. If it's the first stage of every cancer, you have treatment options that will make you. So cancer is treatable. It is. Cervical cancer especially is very treatable. But even before it gets to cervical cancer, the HPV virus infection is treatable. You can do cryotherapy, you can do LEAP procedure. It is treatable, yes. And then talking about the vaccine and NGOs and the government, I don't work for the government, so I can't talk for the government, but yeah, it's supposed to be available. So if you look at the routine immunization schedule, 9 years, there's HPV virus on it. Every hospital you go, it's written there. But we know we have a problem with implementation. So it's a different thing talking about it and actually implementing. Yes. So yes, there is that on the books.
You heard the doctor. It's not in our power to, make these things come free and all of that.
It's not.
But you see Nigerians, even if it's free,
oh my God,
they will still not.
Oh my God,
that's the reason they won't even take advantage of it.
Yes,
because it's free. It's free. It's anytime. I can.
Yeah, and you would even go to the schools to give the children, and they'll tell you, oh, I don't know if it's causing it'll make my child be somehow. They have some misconception about vaccines causing some things, Down syndrome and all that.
Say it's 666 that puts in your blood. You heard it during the COVID. A lot of theories came up during that period. But yes, the doctor says she doesn't work for the government, which means these are the things that. Why we'll talk about it, on this platform. Yes. We hope that the government somehow hears about it and tries to implement it if they can. There's a new government, coming in.
Hopefully.
And we
it's
hope
promising.
It's promising. And we hope that these things are being spelt out and dealt with accurately. Yes, if you if you have any question you want to ask the doctor, it's 09073530044 or 09087668888. Make good use of this opportunity or forever remain silent, because we are a few minutes out of this hour. So yes, we have just 5 minutes maximum. So you can call up and ask us what exactly you want. If you cannot call, we have the option of sending messages on WhatsApp on 09097054450. You're thinking of a gift you want to give your sister, your lover, your friend, whatever it is. Let me give you an idea. You go to our YouTube YouTube page at Eagles FM Abuja. Download this video about cervical cancer and give them to watch so that they can be more aware of their bodies and what they are at high risk of contacting. One more call. Yes, somebody's not remaining silent. We're silent after all. Anyways, thank you so much for being here with us, Dr. Harriet. I'd like to tell you to give our dear listeners one more word about cervical cancer, sum it up, and then we will wrap up the show from there.
Okay. So, if there's anything, if this show has been boring, if you haven't really been listening, maybe you're driving out there and you're not really concentrating, the one thing I would like to leave is that you need to take your health into your hands. The onus is on you to look out for yourself, especially as a woman. Women are getting cancer more than men. Numbers don't lie. And we as women, we think about everybody but ourselves. So you have to be intentional about your health. You have to understand that if there's anything you can help, you know, there are things you can do to prevent other things, but you see, cancer is very hard. You just do and you pray and hope that God will help you. Yes, but for this cervical cancer, there's a vaccine for it. If you're too old, if you're above 46, you can't take the vaccine anymore. Yes, but you can go get checked. If you have a daughter, the vaccine is approved for boys too, because men have the virus and transmit it. So even your sons can take the vaccine. If you have a daughter, most especially girls, you have to make them take the vaccine. Help secure their future.
All right, thank you so much, Dr. Harriet.